Hello, everyone. Thank you all so much for coming and welcome. Can everybody hear me okay? Drop like a thumbs up or something if you're. Thanks, Sean. Alrighty, awesome. So, welcome. We are patient health advocates. Um, First of all, we're going to introduce ourselves. I am Max. I'm the president for this year.
Nice to meet you guys. My name is Ryan. I'm the internal vice president.
My name is Sophie. I'm the external vice president.
Hi everyone, I'm Grace. I'm the Research and Development Vice President.
Everyone, my name is Jessica, and I'm going to be one of your resource directors.
Hi everyone, I'm Shannon. I'll be your other resource director.
Hi, my name is Sean, and I'm going to be the community director this year.
Hi, my name is Danielle, and I'm the Outreach Director.
Hi everyone, my name is Delara and I'm the Health Technology Director.
Hi everyone, my name is Audrey and I'm the Member Development Director.
Hi guys, my name is Kiku and I'm the Transitional Care Director.
Hi everyone, I'm Isa and I'm the Finance Director.
Awesome. Excellent work, everybody. Now we're going to talk a little bit about what we do, starting with our overall philosophy. So, patient health advocates strives to improve healthcare outcomes by collaborating with patients and their care teams to connect them to local resources that can address any unmet social determinants of health that they might encounter through caseworking and personalized resource referrals. We like to use this little diagram here. On the left, as you'll see, there's kind of like healthcare, there's the hospital, doctors, and such. And on the right, there are the social determinants of health, those things like food, housing, and transportation. And PHA aims to bridge the gap between them so that people can get the best healthcare they can and lead the best lives they can. Here are some other examples of social determinants of health, not necessarily things that apply to everybody or that you might encounter in your everyday life, but absolutely things that do have meaningful outcomes on patients' lives. Now we're going to talk a little bit more about what that actually looks like.
Yeah. So our work is the bread and butter of our organization is caseworking in clinic. And we can kind of think about that in two parts. So the first part is our in-clinic intake. And this is when we will shadow physicians in internal medicine and pediatric clinics at UCLA Health Santa Monica. And after the patient visit, we will get to talk to patients and families in a sit down, like one-on-one interaction about any care gaps. So about any kinds of social or environmental factors in their lives that might be contributing to a lower quality of life. And so we'll get to know them through that kind of conversation. And during that conversation, we'll be conducting our intake using in-clinic tablets to assess those social determinants of health. And so once we have all the necessary information, we move on to step two, which is resource delivery. And that's when we utilize our internal databases, MyMaps, and external searches to determine personalized resources for patients. So this is kind of research that we do outside of the clinic on our own time. And when we find the most personalized resources suited to their needs, we will provide those resources to the patients via email most often or telephone sometimes if that's their preferred method of communication. And so in that way, we kind of build relationships with the patients as their resource needs evolve. So we will follow up with them in 2 weeks to check on, how are they kind of doing with the resources? Were they able to utilize them or not? But on the internal side, Scope PHA is a little bit more of a complex organization, and we've developed a project team system to improve patient care and community within our organization. And so what that looks like is 6 distinct project teams. We have resource, outreach, community, health tech, member development, and transitional care. What's kind of special about this year is transitional care used to be for like current members only to join like after their first year of PHA, but this year we have opened it up to everybody. So on the application, if you are a reapplicant, you can check it out. Transitional care is open and recruiting, and it is very exciting. So I'll let the project team directors talk to you guys more about what they actually do.
All right, starting with resource, one of our goals for this year is to have both internal and external committees. So for internal, we will be working on consolidating community resources for our caseworkers in clinic, physicians, and patients on public health topics such as transportation, mental health, parenting, childcare, etc. And we will also be working to update the My Maps platform. And My Maps was traditionally used on Google My Maps in order to help caseworkers look for resources for patients based on their zip code and other demographic information. And we will be moving that to Google Spreadsheets in order to streamline the process of providing personalized resources via email to patients after our clinic shift. And one of our goals is to encourage collaboration among committees within PHA and also help equip members for clinic.
And on top of that, we would really like to emphasize that our resource project team does extend beyond the clinic into the community, and we really like to implement upstreamist concepts in the community. And so some things that we did last year was high school outreach. And so we partnered with two high schools in Los Angeles, and we presented to them on nutrition and fitness, how to stay healthy and fit, and also the basics of health insurance and how to navigate transitional care as young adults who are maybe soon going to be off their parents' insurance and on their own independently. And we also partnered with APA to attend health fairs in K-Town and serve our local Asian American populations, which are two of the photos that we see on the slide here, which is really exciting. And we love having our partnerships with other UCLA organizations. And something that was also really exciting that we started this year was partnering with Vituity to bring resources to the unhoused. And so we very much like to stress resources on the go. So we bring those caseworking skills that we have in clinic out to our community so that we can provide them with resources, resource referrals such as housing, employment, nutrition. And this does relate to our upcoming goals for this year, which we really want to solidify our caseworking booth. We also want to partner with more organizations to really increase our resource outreach and work with specific populations and community issues.
For outreach, our main goal as this project team is to kind of create media about different public health topics, including videos, podcasts, articles, letters to policymakers, animation, graphics, just to kind of advocate for these principles of upstreamism and different public health topics that we're all passionate about. Also, another part of outreach is initiating collaborations with different organizations on campus. So kind of similar to the resource team, we also do outreach outside of UCLA. One of these is soup kitchen visits in a soup kitchen in K-Town. So what the workshops will look like during project team meetings is that we will learn like different Adobe programs, including Adobe Premiere Pro, Audition, Illustrator, and Photoshop, as well as different skills, including how to conduct interviews, how to write for the ear for like podcasts, and how to create all of these different kinds of media. Another goal of outreach this year is to document all of the PHA events. So we have like the banquets and retreats. And so as part of outreach, you would also be involved in making media for those.
All right, so moving on to member development, I think at its core, this committee kind of works on ensuring members have impactful experiences that foster growth beyond just caseworking in clinic and some of the resource work you might be doing as a member. So what that might look like is also just like planning general meetings, which would be bi-weekly, and trying to promote any professional or academic growth within the club. I put some examples here. So we have like research banks, there'll be opportunity banks, things like that, and also just organizing workshops, mentorship programs, and skill development events. Also, this year we want to try coordinating connections with healthcare professionals, guest speakers, and alumni, just so that we can get valuable networking opportunity for our members.
In the community team, what we do is basically maintain the welcoming and inclusive environment for everyone in skilled patient health advocates. And we do this by organizing in-person socials. So what we would do in the team is create a social calendar for the whole quarter so that we just let everyone know in in like ahead of time when these socials will be and what we'll do so people can plan accordingly. And we'll also plan general member retreat, and we also facilitate end of year banquet and senior send off. Also creating engaging content for our internal Instagram, our Finsta, and we have two side projects this year. And one thing we would like to emphasize more is health and wellness within Scope Patient Health Advocates. As people get overwhelmed with school and everything, we just wish to make Scope a place where people can be more aware of their health and how they're doing. And we will do this by creating, I guess, holding mental health exercises within meetings, having gym days, like run days, and having like even an IM League team. We're still figuring that out. But yeah, and our second side project will be preparing content for book clubs. And you can talk about anything you are passionate about. That could be like social movements or any problem or topic about the world that you'd like to share out and discuss with your other Scope patient health advocates. Or you could also present content like that personally interests you, like baking or cooking. And yeah.
Hi, everyone. So the health tech team is centered upon data and research. And this past year, we had the really, really incredible opportunity to get to be undergraduate researchers under Dr. Dana Herman. She's part of the UCLA Fielding School of Public Policy. She's a member of their faculty. And her research is centered upon making nutrition more accessible to individuals who are especially underprivileged or underhoused, especially within the Ventura County population. So what the health tech team members were able to do was that we helped with the post surveys of her work. And then we actually compiled an analysis with her work and actually how it connects with our caseworking, which we were able to present Undergraduate Research Week this spring. So this photo here is my lovely team and I doing our presentation. And it's great because we have hands-on experience, not just how public health manifests within the medical sphere, but also within other spheres and how research takes place in this different discipline. This current year will actually have more opportunities that include grant writing with her, as well as continuing on with the project and hopefully helping her expand it into other counties. On the other end, we do some internal work as well. We help with all of the onboarding that our other members do. We also are looking to do some more internal support, so helping the rest of our project teams with different technology focused endeavors they may have, and also helping with the research brew and walk, anything that kind of goes into that category. This team is typically smaller and we like to be tight knit, and we're all foodies, so there's a lot of different opportunities to hang out as well.
Hi, so as Sophie already mentioned, transitional care is recruiting for new members as well, so that's really exciting. But at its core, what transitional care strives to do is bridge the knowledge and resource gap that exists in the transition from adult or pediatric to adult care. And topics ranging from things like how do we switch insurance, or how do I even learn how to talk to doctors, or how do I refill medication, or how do I figure out my new doctor, et cetera, et cetera. So many things are kind of just not talked about and assumed to be known. So we want to bridge that gap, and we work really closely with our TC advisors as well as our PHA advisors as well, who is Dr. Ma and Dr. Dwan, as well as the clinical social worker at the Santa Monica Clinic, Ms. Cindy, to create a TC resource guide for this quarter, which the residents are going to use to refer their patients and the patient's parents for. And we're going to heavily focus on things like insurance and a little bit more complex topics. We're also hoping to make informational TC videos. In the corner, you see the TC website. So we have a website that's separate from PHA that focuses very heavily on the resources that we offer. So you can take a look and see the type of like infographics, PDFs, different resources that we've created and offered throughout our years. I'm also hoping to do a lot more outreach and presentation opportunities. One place is Westside Regional Center that we worked with last year, and we created some one-pagers for them, but we're hoping to present at their annual event for high schoolers as well as other organizations as well. But if you're looking for a very collaborative team working with everyone pretty closely, as well as the doctors, this is a great team for you.